So the IMPERIAL study is the first in men trial with a head-to-head comparison of two drug-eluting stent devices, the Eluvia stent and the Zilver PTX stent, and that was done in a 2-to-1 randomization. It was a multi-center randomized trial which has taken place worldwide. It was a single-blind, non-inferiority trial, and we included 465 patients in this trial, and we compared in the 2-to-1 randomization the Eluvia stent against the Zilver PTX stent. So it was the first head-to-head comparison of two endovascular devices. Yeah, I had the privilege to present this year during the 2019 LINC conference the subgroup analysis of the diabetic subgroup. So in more than 100 patients who received the Eluvia stent, they suffered from diabetes. More than 60 patients suffered from diabetes in the Zilver PTX group. And even this subgroup analysis with challenging lesions, meaning we had to deal with a lot of occlusions, we had to deal with a lot of calcifications. We could achieve also a very high primary patency rate of more than 87% for the Eluvia stent, and that was dramatically better than for the Zilver PTX stent. So probably I would first answer the safety question, and we could prove in this trial, in this subgroup analysis with more than 160 patients, that in both groups no death occurred. That means the device seems to be safe. In terms of stent thrombosis, we noticed that with the Eluvia device, stent thrombosis rate was 0.9%, and it was significantly higher with the Zilver PTX stent. However, both devices are safe. We now, at the moment, there are a lot of discussion about paclitaxel for DCB devices, for DES devices, and since the Katsanos publication is meta-analysis on DCB and DES devices, he told us that probably the application of paclitaxel might be related to an increased death rate compared to devices without any drug on board, meaning plain balloon angioplasty, meaning PTA, or a self-expanding stent. I think from the subgroup analysis of the diabetic subgroup, we can clearly say that in this challenging subgroup, the concept of a self-expanding stent, which is built on the so-called Innova stent platform, meaning the Eluvia stent combined with the Promos polymer, performing drug elution over time up to 1 year, is a safe concept. And even in this challenging subgroup, we obtained, I would say, really exceptional results in terms of primary patency. Last but not least, we need more data, we need longer follow-up times, and in this IMPERIAL trial we have a follow-up time over 5 years, and due to the clinical event committee, which is completely independent from this trial, we will gather further evaluation and information if paclitaxel in the future will be an issue with these kind of devices.